October is Breast Cancer Awareness Month, and with more than 300,000 women being diagnosed last year alone, early diagnosis is key.
It certainly is. And here with ways to reduce our risk is Dr. Anna Karamanidis with P3 Medical Group. Doctor, welcome to the show.
Thank you. It's good to be here.
Great to have you.
All right. This is such an important topic for all the women who are watching right now and their families as well. Early detection is still just so important, isn't it?
No question about it, and it's definitely a topic that's near and dear to my heart. I lost a 51-year-old sister to breast cancer.
Wow.
Oh.
Because we didn't have a family history, and she did not think mammograms were necessary, but I'm here to tell you that early detection is definitely key.
At what age should we be starting mammograms in the first place, do you think?
It depends on which society you listen to, but it's usually between the ages of 45 and 50.
Okay.
You definitely need to be having them. Some women start as early as 35, but between 45 and 50, you definitely should be having an annual mammogram.
You'd start there early if there was a history, perhaps, within
Correct.
the family. Gotcha.
Correct.
So in addition to screening, which is absolutely key, and there's so many great places to do that here in the Valley, there are some lifestyle choices that can really affect your risk of breast cancer as well. Let's talk about those.
Definitely. And I know as doctors we sound like broken records sometimes, but a good, healthy, clean lifestyle is what can make a huge difference. We know that smoking does contribute to breast cancer, especially in premenopausal women, and obesity in postmenopausal women contributes, as does alcohol consumption. For every 2 to 3 drinks on a daily basis, it increases a woman's risk for breast cancer by about 20%.
Wow.
So limit your alcohol consumption. Don't smoke. If you do smoke, talk to your doctor about it. There are a lot of things we can do to help.
Absolutely. Are there any foods in particular that we should be avoiding, or no?
There's no specific food that we know causes or prevents breast cancer, but a healthy diet with lots of leafy green vegetables and fruit
Certainly doesn't hurt.
It actually has been shown to help.
Wow.
That the leafy green vegetables and the fruit with the antioxidants they have in them do help decrease your risk for breast cancer.
Phenomenal.
I think it's interesting you mentioned, you don't want to sound like a broken record, and yet we're always kind of reminded of these same things. And if none of us are perfect, right? So there might be some things on that list where like, uh-oh, that's me, I'm bad. And I think that sometimes that keeps people from going in and getting tested because they're actually sort of afraid of their own behavior.
They don't want to go to confessional, essentially, is what it is. Yeah.
And it's important to not do that, to go in and get screened and see your doctor and talk to them about it anyway, right?
What you need to know is that your doctor is your advocate. They're not there to be judgmental. They're there to help you make the changes you are ready to make. We can only recommend changes. You have to make them. We're there to encourage you. And I find for a lot of my patients, just giving them the facts, just telling them, here are the facts, here are your options, what would you like to do? You choose what you would like to do, and I will support you. And if you're not ready yet to lose the weight, or you're not ready yet to cut back on your alcohol, I will still keep taking care of you, we'll still keep screening you, and we'll keep talking about your options at visits.
Many older, I know that the genetics obviously play a role, we were just speaking about that earlier, and many older women also undergo hormone therapy. Does that play into the risk as well, or no?
Yes, so hormone replacement therapy is a lifesaver for many older women who suffer with menopausal symptoms. And we do know that especially combination progesterone estrogen therapy does increase your risk for breast cancer by almost 75%.
Wow.
Now that may sound like a huge number, but the importance is to sit down and have the conversation with your provider about the risks and benefits. And the recommendation is to use as little of it as you can for as short a period of time as you can get away with. And I have had patients who are just miserable into their 70s with menopausal symptoms. And we always discuss the risk and benefits and then make a decision together about what's best for that particular patient, knowing the facts. So I feel like I'm there to give them their options, tell them what the risks are, discuss the benefits,
Yep.
and then we make a decision together about which way to go.
Thank you. We just want to make sure we touch on Medicare Monday, this Monday before we
Yes.
go.
So
Big
the
dates.
annual election period starts on Monday, the 15th of October, and lasts until December the 7th.
Yep.
And a lot of seniors have an option to improve their health care by looking at the options that Medicare affords them and getting the care they need.
And make sure that it can bring you to your doctor of choice as well. It's great to have you.
Great
as
to
always.
have you.
Thank you
Nice
so
to
much.
be
Thank you.
here.
Thank you.
All right, P3 Medical Group. They have locations throughout the valley, including a new Pecos clinic. It's opening next month in Henderson. That's where you're going to find Dr. Anna. That location, right there on your screen, by the way. To learn more about P3, you can head to the website or call the number on your screen. P3 Medical Group, a proud sponsor of the Morning Blend.
They have locations popping up all over.
They certainly do.
My goodness.